Good morning. We are the Sweet Ladies team.
I'm Lailani.
I'm Rita.
I'm Harnit.
And I'm Manjot.
And my name is Gloria. We are now presenting our topic. It is all about
Diabetes type 2.
It's type 2 diabetes. Diabetes mellitus, also called diabetes, is the result of the body not creating enough insulin to keep blood glucose or sugar levels in the normal range. Everyone needs some glucose in their blood, but if it's too high, it can damage our body over time. In type 2 diabetes, which is an impairment in the way the body regulates and uses sugar as a fuel, this long-term and chronic condition results in too much sugar circulating in the bloodstream. Eventually, high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems.
Foods containing carbohydrates and sugar are broken down into glucose. Glucose, as mentioned, are the important source of fuel in many organs in the body. However, to be able to use the glucose for fuel or energy in many parts of the body, the glucose molecule must enter first into the cell, the human body cell. Now we'll go to the pancreas. The pancreas produces hormone called insulin. Insulin is the one responsible or to control the glucose level into the normal range from the bloodstream to enter into the cell. Now, in type 2 diabetes, cells become resistant to insulin and ignore message to absorb glucose. This is known as insulin resistance. In addition, pancreas is unable to produce enough amount of insulin needed to trigger the resistant cell to take in glucose from the bloodstream. Therefore, glucose accumulates or builds up into the blood. That's how the diabetes type 2 takes place. In addition, the pancreas is located behind the stomach in the upper left abdomen, surrounded by other organs like liver and small intestine. And it is spongy and about 6 to 10 inches of long.
This is the normal and type 2 diabetes pancreas, which shows the difference between that how type 2 diabetes working in this. In pancreas normal, when they produce insulin, it goes through the blood vessels. Because the glucose channel is open, they control the glucose level in blood vessels. But further, in type 2 diabetes, when pancreas produce insulin, they go through the blood vessels, but the glucose channel is closed, which can't control the glucose in blood vessels, and which leads to the type 2 diabetes. And this has happened between the type 2 diabetes and normal pancreas.
And there are also some early signs and symptoms of type 2 diabetes, like frequent urination, like when your blood sugar level are high in your blood and your kidneys try to filter it out, the excess sugar, then people are more often go to the toilet for peeing, particularly at night. So it can increase your thirst as well. So increased thirst or increased hunger are also another symptoms of type 2 diabetes, and there are also more like slow healing of bones and cuts, like the sudden weight gain or weight loss, and dizziness, feeling tired, blurred vision, and or anyone can affect these symptoms. So if you have any one of them, so please you should visit your doctor as soon as possible. Anyone can develop type 2 diabetes, but there are also some causes and risk factors, like if you have a medical history of gestational diabetes and high blood pressure, heart stroke, and if you have any family history, because it runs in families. So if your parents and grandparents have it, the chances of you're at a risk. And Overweight is also the main cause of type 2 diabetes, because people eat a lot of food which are high in fat and high in sugar, so they can lead to obesity. So inactive lifestyle are another cause of type 2 diabetes. And there are also some, if you are age or over 40, and if you are smoking and under stress, the chances of having type 2 diabetes.
Type 2 diabetes, many health issues can arise. Short-term problems include blood vision, hearing loss. Also, there is a link between the skin problem and type 2 diabetes, like foot ulceration, skin tags, dark patches on skin, and the kidney and urinary system. And high blood sugar level can damage our blood vessel in kidney, which stop filtering the waste out of the blood, so it can lead to a kidney failure, heart problem. Type 2 diabetes can damage the large blood vessel, which can lead to the musculoskeletal disease, which include the heart problem like heart attack, heart stroke, nervous system. Type 2 diabetes cause diabetic neuropathy, or it can damage our nerves, which affect the perception of hot, cold, and pain.
Prevalence in New Zealand is increasing day by day in our type 2 diabetes. Over 20,000 people in New Zealand is suffering from type 2 diabetes. Maoris, Pacific people, and South Asians are the most common as compared to others in New Zealand who are suffering from type 2 diabetes. Furthermore, the health issues in New Zealand is the most common one is high blood pressure, which is very common in people. It is doubled in New Zealand in last 12 years, and children under 15 are suffering from type 2 diabetes are more common nowadays. Obesity and pre-diabetes are also one of the health issues which is people are suffering from at the moment in New Zealand.
Health practices of diabetes. Health practices of diabetes, you need to know your risk. If you are in your family, if it is hereditary, you need to know. Get screened so that you know if your blood sugar is high. Have a healthy diet, eat vegetables and fruits. Have a good exercise, lose weight for you to become healthy and not to acquire diabetes type.
Sum up, type 2 diabetes is the most common form of diabetes. For many people, but not all, it can be prevented through following a healthy lifestyle. While diabetes type 2 cannot be cured, it can be managed, and people with this disease can and do live actively and healthy.
We thank you.
And we hope
You understand?
Our presentation
About
type 2 diabetes.